Hello, everyone. Welcome. My name is Raul Melendez, and this is MPA 520 Public Sector Leadership. Today, I will be presenting on the extreme heat crisis in Riverside County. I will begin with an extreme heat crisis overview, followed by a discussion of affected populations. I will then cover the duration and system impacts, address the leadership response, and conclude the presentation with closing remarks. What is the crisis? Extreme heat is a growing public health emergency, especially in the Inland Empire or Southern California. These events are increasing in frequency and severity and impacting both physical and behavioral health systems. Who is impacted? Approximately 2.4 million residents in Riverside County are affected by extreme heat based on recent data from 2024 and 2025. Higher risk groups include approximately 4,000 individuals experiencing homelessness, older adults age 65 and over, individuals with chronic illnesses, behavioral health populations, and outdoor workers. According to Riverside University Health System Public Health, heat related illnesses in Riverside County has shown a consistent upward trend from 2017 through 2024. Emergency room visits increased from approximately 709 visits in 2023 to approximately 1,627 visits in 2024, reflecting growing demand on healthcare systems. In addition, approximately 65 to 66 heat related deaths were reported in 2024, highlighting the severity of these events at the local or county level. These impacts are most pronounced during peak summer months, particularly from June through September, demonstrating an ongoing increase in both health outcomes and system strains. Extreme heat events typically occur between May and October, with the most intense heat waves from June through September. These events last several days, 2 weeks, and often repeat throughout the season, which impacts continue beyond the event itself. Extreme heat impacts multiple systems at once. For example, healthcare and behavioral health systems facing increased demand, while public health, social services, and housing programs must also respond. Another industry impacted is the energy systems, and outdoor industries also experienced the added strains due to the peak demand or hours. Cooling centers are a key response to the impacts for extreme heat, particularly for vulnerable populations. They are operated by local governments and community partners, which receive support from state coordination and funding across multiple levels. Maintaining these centers requires staffing, utilities, transportation, and outreach to ensure that these services are accessible during extreme heat events. Responding to this crisis requires coordination across agencies. Public health monitors conditions, emergency management coordinates the response, and public safety and social services supports vulnerable populations. Leadership ensures effective coordination and communication. According to the Office of Environmental Health Hazard Assessment, extreme heat events are projected to become more frequent, more severe, and longer in duration over time. As a result of the demand, healthcare systems, emergency systems, and public programs are expected to continue to increase. These impacts will continue to disproportionately affect vulnerable populations, including older adults, individuals experiencing homelessness, and those with chronic health conditions. Addressing this crisis requires coordination across sectors leadership. It also requires an effective response to growing system demands across healthcare emergency services and public programs. Most importantly, it requires protecting the most vulnerable populations who are disproportionately impacted by extreme heat. These references support the uh, data utilized in this presentation. Thank you so much for watching this presentation.